Good morning, everyone, and welcome to this online presentation hosted by Mental Illness Fellowship of Australia about meeting mental health challenges and our official close of Schizophrenia Awareness Week 2020. My name is Hayley Abel and I'm the Strategy and Policy Advisor at Mental Illness Fellowship of Australia, or MIFA for short. I'm joined today by our MIFA National CEO, Tony Stevenson. We are so pleased to be working with One Door Mental Health to bring you this webinar to officially close Schizophrenia Awareness Week this year on World Schizophrenia Awareness Day. Before I introduce our speaker for this morning, I want to begin by acknowledging the traditional custodians of the land on which we are all meeting today all around Australia, and I pay my respects to their elders past, present and emerging. This is a live recorded webinar and you will only be able to hear from our panellists today. There is a chat box where you can type in any questions and we will have an opportunity to answer your questions at the end of the presentation in a question and answer session. So to start, we'd love to know where you're joining us from today. Tony and I are in Brisbane and we experienced a bit of a cold front yesterday that's been the talk of the town. So we will leave a question in the chat box for you to answer. Where are you from and what's the temperature there this morning? So let me begin by introducing your speaker, Tony Stevenson. For more than 35 years, Tony has been committed to a viable and proactive health and community services sector, which works alongside families and individuals to inspire self-confidence and hope. He has held CEO-level positions with some of Australia's most well-respected not-for-profit organisations, as well as executive roles in the Commonwealth and state governments. It is my great pleasure to now hand over to Tony.
Well, thank you very much, Hayley, and welcome everybody. Yes, as Hayley said, a very chilly start to the day in Brisbane, and we're certainly not used to such a cool start. I think it got down to 5 degrees overnight. It's a great privilege to be able to address this issue this morning about the challenges ahead of us, and also to officially acknowledge what a successful week Schizophrenia Awareness Week has been this year. The system is a little bit slow. I think it's taking after me this morning, a little bit slow, but I'm sure we'll get there. The Mental Illness Fellowship of Australia is a federation of organisations right across Australia. We represent Skylight in South Australia, Bridges Health and Community Care in Central Queensland, MIFA in Western Australia, One Door Mental Health, as I'm sure many of you are aware of, in New South Wales, Selectability in North Queensland, the MIFA NT organisation in the Northern Territory, and the Mental Health Foundation of the ACT. We are a federation of organisations that have been working together since the mid-1980s, and we support about 20,000 people a year, mostly people with severe and complex mental health conditions, and that's done through a network of 60 service locations across Australia. We provide specialist community-based and community building recovery support programs. We absolutely commit ourselves to the philosophy and the practice of recovery. Over 60% of the people across our organisation, from the board to the staff to our volunteers, have a lived experience either as a consumer or a carer. And I certainly put myself in that situation as well, in terms of my own family and my family responsibilities as well. As I said, we have a strong focus on recovery and lived experience. And through the National Federation, which is myself, Hayley Abel, who you've just met as well, and Donna Didlick in our team, and you may have taken part in Donna's webinar this week as well. So through our national team, we're able to provide national advocacy to amplify the voice of people with lived experience. We also provide other programs and activities nationally as well. We get together with federal parliamentarians a couple of times a year. It's great to see the federal parliament working as one. We don't see that very often, but there are a group of people right across all political parties who have an interest in mental health, and they come together as the Parliamentary Friends for Mental Health. And we're able to bring speakers with lived experience directly into Parliament House and talk to the parliamentarians regardless of their political colour, who are interested in advancing policies and federal responses around mental health. We conduct our awareness campaigns every year. Of course, Schizophrenia Awareness Week is one and Mental Health Week is the other. We also operate across our member organisations a mechanism for people to connect through My Networks. Wherever we are across Australia, we know the services available, we know the networks that operate in those communities, and through My Networks we connect people locally into services in their area. And we also operate the Psychosis Australia Trust, which is a group of researchers and others, people with lived experience, people from the business community, who come together to try and shape a more strategic approach to research around psychosis in Australia. So Schizophrenia Awareness Week this year has been so successful. Our theme for SOAR 2020 is Stay Connected, and it is a simple message for our times. When you're living with schizophrenia, staying connected can really help. We wanted to emphasise this message this year because we know that people have been quite anxious, stressful, and sometimes quite fearful of what's happening during the COVID-19 pandemic. It's more important now, more than ever, to stay connected to family and friends, to mental health support teams, and to the community, so that we can continue to get the support that brings us joy, hope, and a sense of belonging. We've been running a social media campaign during the week, and you may have seen some of those posts. We want to provide practical suggestions for people so that they could stay connected and reach out for support to our free 1-800 number. We wanted people to feel empowered to stay socially connected during a time of physical isolation and to keep connected to the services and support they need to live well. And we all know how disrupted our whole lifestyle has become during the pandemic. I'm sure that for many of us, the familiar places that we go for enjoyment, for support, for community connection, they've been quite disrupted, hopefully temporarily. But we've urged people to connect in with our My Network's 1-800 number to seek help and support if they were experiencing any mental health issues, or if they found themselves needing additional support to stay well during the COVID-19 pandemic. And we know, unfortunately, that less than 50% of people with schizophrenia are getting the supports they need. So during Schizophrenia Awareness Week every year, we urge people to reach out to get more support at this time. We emphasise the importance of staying socially connected but unfortunately still physically distant from others. We provided practical tips and suggestions for how people could stay connected to support their mental health and well-being. This included tips for keeping well, like maintaining healthy habits, keeping a daily routine, and reaching out. We know it's been a very challenging time for many, as the routine of support has been disrupted. Familiar places for support may have closed down, and face-to-face support has been replaced with telephone and online support. But it's still just as relevant now to share a message of hope for the future. With the right supports, people with schizophrenia can and do recover. Some research shows that 1 in 3 people will fully recover a healthy life in their community, with less frequent and less severe psychotic episodes. We know that there is no cure for schizophrenia. It can't be prevented, but with the right support, recovery is possible. It's important for people living with schizophrenia to know that they can reach out for support, and that we are here to listen and connect them to local services in their area to meet their needs. Another integral part of our yearly campaign is to bust common myths that still exist about people living with schizophrenia. MIFA aims to raise awareness of stigma and discrimination in the community, because it is actually the stigma that often prevents people from talking about their health and for reaching out for support. We want to continue to challenge some of the untrue beliefs that many people still hold about people living with schizophrenia. Some of these ridiculous myths are that people with schizophrenia are violent, that they have split personalities, and that people living with schizophrenia can't hold down a job. We know that's not true. We want people to be accepted for who they are and not be judged because they are living with schizophrenia. We want people to be valued for who they are and not be defined by mental illness. People don't want to be treated differently because they have schizophrenia or any other mental health condition. So, of course, one of the ways that we continue to educate the community and particularly lobby the government to provide the services that are needed in our community is through our advocacy role. And we do build strong partnerships. We have a strong reputation with government. Government understands that because our federation has been working for over 35 years, it's very much a grassroots organisation. It was formed and continues to be run by people with lived experience, carers and consumers, through our boards, through the constitution of our member organisations. That gives us some legitimacy with government. They see that we truly amplify the voice of lived experience through our advocacy. One of the ways in which the mental health system is portrayed is through the stepped care model. And many of you may have seen this particular model, which was published in the Productivity Commission's draft report. And this type of model attempts to show the experience of mental health conditions across our community, from the 26% of the population who are experiencing a form of mental health condition that can be addressed through self-management, through self-help information and a range of resources. Another almost 5% who will seek, let's say, low intensity care through their GP, perhaps through online treatment or group therapy. Another group with moderate intensity care will require additional interventions from their GPs or perhaps psychological treatment. And as you can see, the steps proceed through a group of about 400,000 people with high intensity care, perhaps requiring psychiatric or clinical support, and another 350,000 people experiencing quite significant severe mental illness with additional complexities, and a range of other supports that should be available to people in that situation. And as you can see in that column, psychosocial supports, which is the role that we play through MIFA and our federation. And all of that is underpinned by the non-health supports, sometimes referred to as the social determinants of health. And many people would say that the social determinants make up about 80% of the solution to people's health, and the medical, health and other psychosocial supports perhaps provide the other 20%. But having sufficient income to live in, having a place to live, having secure housing, ensuring that people are not ending up in the justice system, in prison, that they're able to complete their education and move into work. So that's certainly one way of explaining what the mental health system is. So MIFA, in our advocacy role, attempts to bring to light the issues, the challenges, the solutions across that mental health system that ensures that people with severe and complex mental health condition get the support and the services that they need. As I said, recovery is possible for people if they're able to receive the right support at the right time. And that support, of course, comes right across that mental health care system. It comes from GPs and allied health professionals and psychologists. It comes from psychiatrists. It comes from psychosocial supports, and it comes through being able to have all of those non-healthcare needs met as well. So rather than seeing that as a stepped care model, as you can see from that diagram, it's assumed that those steps are quite discrete and exclusive. And it gives you the sense that, well, perhaps what they mean by that is as your mental health condition escalates, you're moving up those steps. And perhaps when you're more well, you're moving down. To me, that assumes that a person is moving through the system. So the system is the static entity. And what's required of a person is that they're moving up and down those steps, and perhaps even having to demonstrate that they're now sitting in step 3 or step 4. And that gives them the right to the services that are available for that step. A person-centered model always places the person at the middle of that diagram, but of that concept, of that philosophy. And what changes are the mix of services and supports around that person according to that person's current situation. What do they need now? How have their needs changed? If a person has left hospital, perhaps the priority is to get back into stable housing and to reconnect with family. For a person who has good community support, good networks with family and friends, perhaps the priority then is more in one of those community service areas, which is about work. People's needs change, people's situations change. the person is still a person and should remain at the centre of the model. And the system needs to be able to change and adapt to meet that person's needs. So as you can see, through our advocacy, we want to address the challenges, which is what I want to talk to you about now. We're pretty familiar, I'm sure, with aspects of this model. We know how important family, friends, and connection to community is. And still, the majority of support that's provided in Australia to people with a mental health condition comes through informal carers, family and friends. We know what hospitals do. I think most of us know when it might be time to go to hospital. In fact, it is an option that people have when they're unwell, to present to emergency, to seek acute care. And often that happens on an involuntary basis as well. Hospitals are very familiar to us in the community. And I guess you could say it's a system that people know about. Our GPs, our psychiatrists, allied health, there is a pretty robust system around all of that. It's funded through Medicare. It's funded as well through private health insurance for those who do have private health insurance. But again, we can go to a GP, we can get a referral, we can see a psychiatrist, we can get referred to allied health. We know that those linkages don't work as well as what they need to. GPs often don't look at the physical health condition when they're treating somebody's mental health. But there is a system around that part of the medical health system. The NDIS, while it has many flaws still in its design, is starting to address some of the concerns that MIFA and others have communicated around the design of the NDIS. We're starting to see an interest from the NDIS in developing a recovery framework and a new role of recovery coach. Again, the NDIS has a reasonably robust system behind it. But the other two parts of the system, which I want to talk about, community services and psychosocial support, certainly lack the coherency that we need in an effective mental health system into the future. Those community services are absolutely essential to a person's health and well-being and mental health. Having stable housing, having access to education, to work, to the justice system, and having enough income to live on are all so important, but are often very difficult for a person with a severe mental health condition to get the right support. We see the glue that holds all of that together as the psychosocial support. That is where, through our support workers and peer workers, we're able to work alongside people to share the goals that people have and to build the resilience and inner strength, to build and strengthen those natural connections with family and friends, and to build the connections into the community right across all of those aspects of the system. And when you look at that whole system, it's the psychosocial support that is the most vulnerable. It's underfunded. The funding is temporary. It's ad hoc. There's no clear responsibilities across the levels of government. So we have a system which costs now almost $5 billion a year. And the most critical aspects of that system, the psychosocial support that links all of that together, and the non-health or community services aspect, which is so vitally important, which are the most fragmented and the most challenging. And that's where MIFA's advocacy continues to be as we look at the challenges for the future. And we've identified that as the missing piece of the mental health system, where we have our Commonwealth and state territory services and hospitals and MBS and Medicare, that is, pharmaceutical benefits, the NDIS, our public health systems. We don't have a truly national system of psychosocial recovery support. That's where we believe gives us the greatest potential to maximise the participation of people living with severe mental illness, to give people the greatest potential to contribute back into the community, and over time, in fact, to reduce the level of government expenditure required to support people to live life to their maximum potential in their community. We believe that that's the intention of the 5th National Mental Health and Suicide Prevention Plan. And I must say that it's quite disappointing to see the 5th plan now not really driving the reform of the mental health system in the way in which it was intended. There are many aspects of a good system at play across Australia, but those dots are not being joined up. And MIFA's advocacy will continue to encourage government to join those dots together. We have 31 PHNs, primary health networks, across Australia. If they're located in a rural and remote area, then that is the best hope we have for a rural and remote plan to be developed. If those PHNs represent Indigenous communities, then that's the best hope we have that a plan for that Indigenous community will work. PHNs do their regional plans, and done correctly, they bring the community's voice into that plan. That is the best way that we're going to have the right set of services and supports available that is relevant to every community across Australia. We also have a national mental health services planning framework, but do we see evidence of how that is being used? To join up the regional planning with the national mental health services planning framework gives us the best opportunity we have to get the right mix of services at each community right across Australia. And in fact, we don't expect government to come up with additional funds without knowing what those needs are. But we do think that there are funds in the system at the moment that can be rolled into a national psychosocial recovery program, those existing commitments of government. But if government was then to commit to the regional planning and the national mental services planning framework, then they will have the tools they need and the information they need to plan for the additional investment in those services that is going to meet those specific needs of every community across Australia. After all, this is the sort of system that we are looking for, an integrated wellbeing approach. Now, I've borrowed this slide from the National Mental Health Commission, but this is the sort of vision I think that many of us have and have had for a long time, that social and emotional well-being is a product of the social and human services sector working well. That is, those community services, those social determinants of health. That's working alongside the physical healthcare system, because we know of the incredible comorbidities that people with mental health conditions also have, that reduces their quality of life and even their life expectancy quite considerably. And of course, we have the mental health care system. And it's those three components coming together that will give us the best chance into the future of meeting the needs of everyone in Australia with a mental health condition. And that sums up really the challenge for the future. So we've had a lot of reports and consultations about a future mental health system for Australia. And here are just three of those. There are others too, of course, like the 5th National Mental Health and Suicide Prevention Plan that I mentioned. We've had the Victorian Mental Health Royal Commission and so on. I'm sure you're familiar with many others. But I just want to talk about these three today, because if we're looking to the challenges for the future, how confident are we that the work that's being undertaken at the moment in Australia is going to unlock those challenges? It's going to get us to the place that we need to be. That's going to give us that intersection of the social determinants of health, the physical health care, and the mental health care that we so desperately need in the future. So firstly, the mental health and wellbeing pandemic response. One of the things that I think is the hallmark of the COVID-19 pandemic, and the statistics speak for themselves. We see the statistics worldwide every day, and I think we all feel quite well off in a way in Australia, in the sense that our infectious number of cases, our deaths from COVID-19 has been quite low compared to the rest of the world on a per capita basis. And one of the things that's led to that is the fact that we actually did break down those silos of government to form the National Cabinet and to take advice of the scientists, the Chief Medical Officer and their team, federally, the state and territory Chief Medical Officers. Politicians have taken a back step to some extent. They've listened to the scientific advice and they've generally followed that advice. And they've generally done that as a united system of Commonwealth and state territory governments across Australia. And if anything, that is one of the lessons that we can learn from, and a strategy that we can hope for into the future for mental health. The plan itself, I think, lacks detail. Having a plan, of course, is incredibly important, and we do support the National Cabinet in having a plan and getting the Commonwealth, state and territory governments to agree to the plan. But we think it falls short in the detail of the actions, the timeframes, the responsibilities for doing that, and the accountability for doing that. Of course, it's a pandemic response plan, so it's not going to be the future system reform for mental health in Australia. It addresses the immediate time period, so that's right now, through the current pandemic period. And it also looks at the response and recovery priority actions as well, which I guess is perhaps a 5-year time frame. Governments across Australia are very concerned about the mental health impact of the pandemic. And I think we've all heard those comments from Patrick McGorry and Ian Hickey and others, that deaths from suicide are likely to exceed, perhaps multiple times, the deaths from the pandemic itself. It's vitally important that we address the mental health impact of the pandemic and that we have a plan to do that. You can see that the plan does rely heavily on that level of governance across those systems. And if anything, we believe that it is the silo of the system, or the silos within the system, that is the roles and responsibilities of the levels of government, that is the biggest barrier to reform of mental health in Australia. When people have stayed away from hospitals, when going to hospital has been the way in which they have managed an escalating mental health condition, and they're staying home, and hospitals don't visit you at home. So we don't have the flexibility and the agility to enable those organisations like One Door that do provide support to people in the home to be able to replace the role of the emergency department and take over that responsibility from the state government to support people who choose not to go into hospital. That sort of flexibility and agility just doesn't exist at the moment. And the plan, unfortunately, doesn't unlock the barriers to that immediately, because in fact, we need to see a plan that tells us how we're going to do that next week. And that's not in the plan. So we still have work to do just in the immediate future. But it certainly, the plan adopts, if you like, the principles that we've been talking about, but it's that immediate action that's lacking. This is a vision of the future that I really think has got some great pointers for us. This is the National Mental Health Commission's 2030 vision. Some of you may have participated in the consultations around that. In 2019, there were 26 town hall meetings and 17 service provider stakeholder meetings. They connected with 1,300 individuals across 86 organisations and received over 2,000 online responses to this plan. This is an attempt really to start from the bottom up in terms of understanding what's needed in a national plan for mental health. And then it tries to fix those overarching governance issues first. And we can see this idea of a national agreement. That's because we are dealing with different levels of government. And unless we can get all levels of government to agree, then we're not going to get the reform that we need in the mental health system. So there's a lot in this vision about the governance structures that are going to make this work. The agreement, the leadership, the investment, the national standards, and the design and delivery of all of that. It's an incredibly complex issue when you consider all of those aspects of the mental health system that I highlighted earlier, the hospitals, the GPs and psychiatrists, the NDIS, the community services system. A governance structure has to bring all of that together so that we can keep the person at the centre and look at how that person interacts with all of that complexity across those multiple layers and levels of government of that system. So you can see in this plan, the enablers point to integration. as being so important. The multidisciplinary workforce that goes across those areas. People working in homelessness need to understand about mental health and so on. But I think it is a good vision, and I believe it does give us a lot to consider for the future. But I particularly want to talk about the Productivity Commission's report. Stephen King, the Commissioner, spoke to this symposium earlier in the week. And again, I was really impressed at how the Productivity Commission has understood the issues and have really brought to the fore the person at the centre of the system. Stephen opened his presentation by saying that the COVID-19 pandemic has highlighted absolutely how dysfunctional the system is. And it is so difficult under an emergency to get that system to work in an integrated way. And it must become more flexible and agile. He said that although the clinical system is flawed, at least there is some coherency of a system. But on the other hand, there is no coherency at all. There is no system for community support, and he includes in that psychosocial support. The mantra of the Productivity Commission is this: if consumers don't see any value in any service or any type of support, then that service should not exist. As a group of economists, as he said, that actually is quite intuitive because it's about the customer. It's about demand, and it's how the marketplace wouldn't be relevant unless it met the consumer's needs. It would be so ironic if it took an economist to be the one that can help us sort out our mental health system. But I actually believe that this is giving us the best opportunity to do just that. In the final report, Stephen said he would address two main criticisms of the draft report. Firstly, that there was a lack of vision. And of course, as he said, that vision is about the person-led approach. That the system needs to be seamless and people need to get access to the right service at the right time. The other main criticism was of the draft report that it was too clinical. What he was able to say, and I will have to reiterate what Stephen said, of course, that he is in no position to announce what is in the report, and certainly in no position to make any commitment as to what the government may do with his report. But he did go so far as to say that there are areas in community support, including psychosocial support, that clearly need additional funding. And he indicated that there is a need to establish a system of community-based recovery support. In the interest of time, I'm going to leave it there. Those three reports, those three processes give us some hope, I think, for the future and how we meet those challenges of the future. But it is so important that we have the detail, the specificity, that we break down those silos of government in particular, that enables the person to be at the centre of what is now a far too complex system, and one that doesn't give those two critical areas, that is the community services linkages and the psychosocial support, doesn't give them the capacity to do what those parts of the system need to do, which in fact will make the whole of the system work so much better. So I do have also the role today to farewell Schizophrenia Awareness Week for 2020. It has been an amazing experience this week. One Door has run a symposium for Schizophrenia Awareness Week every year, and I've had the privilege of attending some of those. But this year, we have had over 550 people attend the symposium, being online. It has extended our reach. There have been 21 sessions, far in excess of what can happen when we all come together and meet for an afternoon in Sydney. An average of 63 people have attended each session, and I'm pleased to say that MIFA has contributed across our member organisations as well, through One Door, of course, but also through MIFA, through Bridges Health and Community Care, through MIFA, Mental Health Foundation, ACT, and also the Caring Fairly campaign that we belong to. I do want to extend enormous thanks to One Door Mental Health for putting on such an amazing Schizophrenia Awareness Week. Well done, Kathy Borman, to Gus Soers, to everyone from One Door who has been a part of the best Schizophrenia Awareness Week symposium that we've ever had. Thank you to everybody. So thank you, Hayley.
Thank you, Tony. And thank you to everyone who has been posting in the chat box. So we do have 10 minutes now for our question and answer session. So we'll endeavour to get to as many questions as we can in that time. So the first question that we have, Tony, is from Mary. Mary has said that there is a constant call for people to reach out to services. She's wondering how well does it work the other way around, where services are reaching out instead?
Yes, absolutely. And of course, our campaign, Schizophrenia Awareness Week, is a way of reaching out too, of course. Because many people just aren't aware of the services that are available, and regrettably GPs and others who may have fairly frequent contact with people with mental health conditions don't know about these services. It is a huge difficulty. Our social media posts for this Schizophrenia Awareness Week have been very successful, as I understand, and we haven't got final figures on that yet. But Mary, it is a challenge that we constantly have, and any suggestions that you have about how we can better reach out to people, we would love to hear about that, because it is always one of our challenges. And I know of somebody with who has had very, very close involvement, has always said to me, well, you know, I just wasn't aware of the need to know about anything until I became somebody who needed this support. And so the promotion of our work, I'm sure, is very difficult to reach people, but so important once people have a need for that.
Thanks, Tony. And Mary's just left a comment there that she thinks mental health units in hospitals are one of those critical sites for services in the community to reach out to.
Yes, thank you, Mary.
So we have a lot of comments from everyone today, not that many questions. So Tony, perhaps we can just get your thoughts on some of the comments.
Yes, thanks.
So one comment that Mary has also left is that she thinks it's a tragedy that for many people who are living with schizophrenia, by the time that they get appropriate treatment, they may have burnt bridges with family and friends due to that delay of treatment or no treatment at all. And that is what is a great risk to isolation and risk of early death. What do you have to say about that, Tony?
Yes, that is always the theme of our campaigns during Mental Health Week and Schizophrenia Awareness Week, that nobody expects their son or daughter to develop schizophrenia. It is a condition generally that affects the development of the brain. It's not something that families expect. And because of the stigma around schizophrenia, it's not something that we even talk about in our community. So, you know, we might know about what to look for if we spend long periods of time in the sun, and well, there's a risk of melanoma. For our family members that might be working, you know, on farms, they probably do talk about that. When it comes to schizophrenia, we don't. And because, as we know, some of the ways in which people might respond to that early experience of schizophrenia may be quite challenging for families. And because people aren't expecting it, because they're not interested, because of that stigma, you know, they often misinterpret those actions, and that can lead to that fragmentation in family relationships. So it is about education, it's about awareness, it's about opening up the conversation in our community, in our families, in our workplaces, so that if we do come across that experience within our families, then we're able to respond differently to those challenging behaviours, if you like, and focus in on the individual and do whatever we can to get the help that's there and the help that's needed.
Thanks, Tony. Our next comment is actually a good segue after that particular answer. So there's a comment here that carers are the glue in the system at present, doing unpaid case management without the training or resources they need, and many would welcome. What are your thoughts on that, Tony, and the role of carers? Yes,
I absolutely agree with that. And carers do provide the predominant amount of support. So we had a presentation earlier in the week from Caring Fairly. That's a new consortium that's been set up by Mental Health Carers Australia, Mind Australia, the Mental Health Australia, and MIFA. We think it's critically important to raise the profile of carers politically, to get government to understand the role of carers. There is a practical aspect to that campaign, and that is to get the carers allowance increased, to get greater eligibility for the carers allowance, and also to get some of those supplements that we're starting to see in the COVID-19 period, the coronavirus supplement, etc., paid to carers. We know that the Carers Gateway is being rolled out. But there is far more that we think we can do and that government can do to support carers, and we'll certainly be working very hard to achieve that.
Great, thanks, Tony. And there's another comment here from Joanne that the person-centred and person-led, that needs to be the basis of the new mental health system.
Absolutely, couldn't agree more with you, Jo, on that point. Thank you for raising that.
And we just have one last comment that you can speak to, Tony, another comment from Mary. It's about the power of the market to drive services that you spoke about in your acknowledgement of the Productivity Commission report. She's wondering how do we acknowledge how disempowered the market of consumers is after some of the treatment that they have experienced. What are your thoughts on that?
Yes, thank you again for all your considered points, Mary. I do feel ambivalent about this area. I think what Stephen King was saying was that we have to dig a lot deeper to enable the consumer voice to be heard. And there are many reasons why that voice is often quite faint, through disempowerment, and I'm not talking about through the individual's lack of capacity to do it. It's the systemic issues that have disempowered that voice. So I guess where Stephen's coming from is that this is not just a superficial process of looking at what people are asking for. It's a much deeper process of really digging deeper and deeper to understand what it is that consumers value out of our system. I think it's quite different from the NDIS, which is also a market-driven system. In that system, I think where the shortcomings of that system are is the overarching quality control, if you like, around that. As consumers, we are vulnerable to the power of advertising, obviously, and the power that some may have to create a desire or a need that perhaps isn't there, or to deflect our priorities in other directions. So there are lessons to be learned, I think, in the way in which the NDIS has taken a market-driven approach. We certainly aren't, I'm sure Stephen isn't proposing a commercialised marketplace idea that has competing products and huge marketing campaigns to direct us to those products. It's more about really understanding what people need and to give people the opportunity to give their considered feedback to the system, to give people that real choice and that real control over the system. I believe that philosophies like recovery, the recovery approach to support, if they're not well enough understood, they may not be what consumers ask for. And that's why I feel ambivalent to some extent. But we must place that trust with consumers, and we must do what we can to empower communities, to empower consumers, and to dig deeper than what might be on the surface to really understand what consumers need.
Thank you, Tony. Well, everybody, we've reached our time for today. It's 11:30 and we want to thank you so much for being with us today. Tony, did you have any final closing remarks before we end today's webinar?
Well, I'd like to thank everybody for participating, and to say that, you know, we still have a lot more work to be done. I am feeling reasonably optimistic about the future. I think governments across the board have understood that this system is not working. What governments choose to do about that, of course, is another question. We will all want to encourage governments, to educate governments, to continue to lobby and advocate so that we get this system right.
Excellent. Well, thank you, everybody. Thanks for joining the last session for Schizophrenia Awareness Week 2020. We look forward to doing it again soon with you.
Thank you.
Thank you. Bye, everyone.